I welcome everyone on behalf of University of Nairobi and Empower School of Health for the webinar on short courses in public health commodities management. And these courses are being offered to the University of Nairobi's students, alumni, in fact, to anyone in Kenya who wants to have do this course, and this is all done jointly in collaboration. So thank you for the speakers for taking out their time, Professor Paul Lalwani, Mr. Seda Bega, Dr. Sheetal, Professor Andy, for taking out time for this wonderful webinar. We will be discussing on these short courses, and people will come to know about the importance of such courses in their career. Let's move ahead, and I'll now request Dr. Sheetal Maru to proceed as a moderator for this webinar.
Good. Thank you, Rahul, for giving me this opportunity. I will just switch on my video. I hope I'm visible.
Yes, you are.
Yeah. So I would want to welcome all the participants who have registered for this webinar and the courses that we offer under the collaboration between University of Nairobi, UNES, which is the University of Nairobi Enterprise Services, and my MD is present, and the Empower team, Empower School of Health team, that is Professor Lalwani and Professor Andy, Rahul, Sonia, and the rest. So I would like to welcome first of all, Professor Paul Lalwani to give us...
Next slide, please.
Yes. As people are still registering, we want to have some welcome remarks from UNES first, sorry. So I welcome Mr. Seith Abeka, who is the Managing Director, UNES, to give us a welcome remark, and then we'll go to Professor Paul to give us a remark as such, and we will carry on like that. So, Mr. Abeka, please, MD,
yes.
UNES.
Thank you very much, Dr. Sheetal, for the welcome remarks that you've given us, and also as the moderator for the day. Participants, we want to welcome you to this webinar, where we will be having an opportunity to look at the course that we are offering. I am the Managing Director of UNES, and UNES is a consultancy and the commercial arm of the University of Nairobi, and we are doing this in collaboration with the Empower Health Swiss, and the team is excited to be part of this capacity building program, which is global. I'm very happy to see participants from all over the world. You are most welcome to enjoy the services that is provided by UNES and the University of Nairobi and Empower Health. Mine this afternoon is just to welcome you to this session. Thank you very much and enjoy. Over to you, moderator.
Thank you, Bwana Seith Abeka, our MD UNES at the University of Nairobi. I would now like to welcome Professor Paul Lalwani, who is the director of the Empower School of Health, Empower Group as such. So, Prof. Lalwani, please, would like to hear you.
Professor Paul, you are on mute.
Just before Prof comes in, Prof, sorry, let's have some housekeeping announcements with the participants of this webinar. We would like you to kindly mute your mic and turn off your videos when the presenters are presenting or talking. Please ask questions using the chat box, or you can raise your hand using the raise hand icon on the Zoom platform. And we'll actually ask the participants to do a poll so that we are sure about your interest. And these recordings for the webinar would be available on the Empower School of Health YouTube channel, and you could be able to go through them at your own time. We will also share the slides with you as participants, since we have your email addresses you've registered with. And please try and engage us during the question and answer session. So thank you so much. And I hand over to Professor Paul Lalwani to give us a welcome remark.
Thank you very much again. You can move on to the next slide. Yeah, I'll leave it over here for a moment. Okay. So first of all, I welcome everybody, and really want to, the details will come later. Prof. Andy will give you the details about the technical aspects about how University of Nairobi and Empower will help to strengthen and build your career, your skill set, and take you from where you are today to someone even more capable and performing at a much higher level. But let me just pause and share with you the background and the vision of Empower School of Health and Empower Swiss. The founders and co-developers of Empower, nearly all of us are former UN staff. And we've worked with international organizations from WHO to UNICEF to World Bank, to international entities such as whether it's Management Sciences for Health or Chemonics and others as well. So the experience that we bring is real world experience. And the idea was to convert all of that into our ability to support you in growing, sharing with you what we've learned along the way. And what we were asked by what started off as us doing classroom training, which now is a fully fledged institute with online learning and on-the-job support. And we're working with in more than 100 countries with over 250 plus organizations. In essence, our goal is to deliver large-scale capacity building, high quality, and delivered at low cost. Normally, these three don't go hand in hand to bring scale, quality, and low cost, but that was what we were requested to do, and that's what we are delivering. The high quality comes from working with partners like University of Nairobi, one of the top-ranked universities across Africa, #1 in Kenya and #7 across the continent. We partner with UN agencies, the Global Fund, UNDP, WHO, UNICEF, you name it. And we bring their trainings. Many of their trainings are free of cost. And as much as possible, we try and bring that to you as well. So imagine the best faculty. You'll hear from Andy. He is my mentor. He has also been fundamental and one of the key people in writing what's called the Yellow Book or the Yellow Bible in procurement and supply chain. You'll hear from him. My personal journey from a career point of view started off as a pharmacist, worked in private sector and consulting, joined Management Sciences for Health, eventually led their division in a few countries and including India, and then moved on to the Global Fund, where I was the highest ranked pharmacist at the Global Fund, and overall managing their procurement and supply chain for more than 100 countries. So anything is possible. This was not my dream, but this is where I ended up. But if you plan ahead, you can get there even more quickly, and we're happy to provide that necessary support. So with that, I give the floor back to the moderator, Dr. Sheetal Maru. Thank you, University of Nairobi. Thank you for partnering with us. Over.
Prof, there are some slides on Empower School of Health. So if we can take up more detail about
I
the
have
capability.
spoken. I'll do it very quickly. I think I've spoken
Yeah.
to it. Next slide.
Next slide, please, Sonia.
Yeah, these are all our partners and clients. On the right, you can see their ministries of health, UN agencies, and various other donors. We've delivered more than 1 million hours of capacity building content to more than 200,000 people across the world, more than 100 countries. Next. We don't work alone. These are all our partners across the world. And especially if you look in Africa, many, many partners, including University of Nairobi. Next. Yeah, this is more clear in terms of who we are and who we're working with. Next. So I'm on the far left. We have Andy, number 4 position. He'll be speaking later on. And we've got many other top people, just to give you a sense. So when you learn with us, when you coordinate with us, when you engage with us, you have access to all of these people, including His Excellency, the former head of state of Ghana, who is one of my personal mentors and a mentor to the organization as well. Next. Yeah, that's fine. And you can go on to, I guess, Prof. Andy, that's the next one. So I think I'm done. Rahul?
Yes, fine, Prof. Now we move on to Professor Andy. Next slide, please.
Let me, instead of him introducing himself, let me introduce him. I've already mentioned briefly about him already. And it's a long paragraph and everything else, and we'll share the slide deck with you. But as you can see, that yellow book, that's a yellow Bible, often referred to as Managing Drug Supplies. Some of the sections were written by Andy. And he really is an encyclopedia when it comes to access to medicines, procurement, and supply chain. He also is the mentor to many of our students. So if you take any of our courses, you'll get to hear from him quite a lot. And if you listen carefully, you'll notice that the voice that's recorded many of our lectures is also Andy's as well. Andy, thank you for all your guidance and support to me and to the students. Over to you.
Okay, let's go to the next slide and we'll go straight into it then. Well, why would you ever consider working in procurement and supply chain? It's often referred to as a Cinderella activity. And like the fairy story of Cinderella, we're often kept in the ashes and starved by the ugly sisters of finance and customs to try and get supplies. And really, the fundamental point is supply chain is not working. Nearly 2 billion people, nearly a third of the world, does not have access to essential medicines. We're failing to get essential medicines to patients. And that's really the challenge. And that's why we're attracted to procurement and supply chain, to address that challenge, to bring healthcare to the people who don't have it now. Next slide, please. It's a situation recognized by the World Health Organization when they said all the donated drugs in the world won't do any good if we don't have an infrastructure for their delivery. If we can't get them to the patient, it's a waste of money, it's a waste of effort. Right now, all the countries are gearing up for COVID vaccines. How are we going to achieve that? It's a massive undertaking to get ready for that. The challenge, even if we get the vaccine, how are we ever going to deliver it and distribute it to all the people that need it? And that's our huge challenge that we try to address in procurement and supply chain management. Next slide, please. One of the major challenges in health supply chain is the lack of human resource capacity. We don't have enough skilled people. We have a massive talent shortage. We don't have people with the basic education. We don't have the specific training. Indeed, we think between 30 and 70% gap in the human resources need. Next slide, please. The Global Fund, the major grant body in the world, is saying we're not able to implement our programs. They're not going as fast as they want because we have 70% vacancy rates in procurement and supply chain management. And that impacts across what can be achieved in healthcare. Because we have underqualified and underskilled staff in the supply chain, it's damaging the supply chain operations. They're poorly operated and managed. And that means they're insufficiently resourced because no one's advocating, no one's promoting their cause. And that leads to poor availability of health commodities. Even when we get the health commodities, even when donors fund them, we're not getting them to the patients. And that means we're failing to achieve our health targets. One of the reasons we're failing to achieve the Sustainable Development Goals. What were the Millennium Development Goals? Now the Sustainable Development Goals. We're not delivering the products. We're not getting the medicines and the malaria bed nets and all the other health products through to where they're needed. It's not happening. And if that situation wasn't bad enough, we now have a huge increase in demand in the future on supply chain. We're looking at a 24-fold increase in the new vaccines that are coming along, a 5-fold increase in new health products that are coming along. How are we going to get those through to the patient if we don't have a cadre of well-trained and skilled staff in procurement and supply chain? Next slide, please. Why is there no human resource capacity in this field? Well, very few schools of pharmacy or schools of nursing or schools of medicine teach procurement and supply chain. And I don't know of any schools of management that teach public health. So we have a difference. It falls between two stools. It's not one, it's not the other. We need both. We need management techniques and we need public health knowledge combined together to make the health supply chain work and to make it work in public health, that is within the public sector. Next slide, please. There are many stakeholders involved in global health supply chain. People tend to think too narrowly. Many organizations, there are bilateral donors, multilateral donors, implementing organizations, lots of bodies involved. When we think about the stakeholders in supply chain, think globally, think about all the different players, all the different activities that go on and the potentials for careers. People think it's got to be in the Ministry of Health, and the Ministry of Health is an important employer, but there are many other people using supply chain, needing skilled supply chain staff as well. Next slide, please. And yep, fine. There are many new products in the pipeline. Right now, there are 200 vaccines, new vaccines in the pipeline coming from development. How are we going to get those to the patient? Over 90 different types of diagnostic tests about to be released. 80 completely new medicines, even for well-established diseases and treatments. We had no new TB medicine for tuberculosis for nearly 40 years. Then we got bedaquiline, a new medicine. We're not getting it to the patient. We're failing to deliver life-saving new medicines because our supply chains can't cope. And the main reason they can't cope, we don't have enough skilled staff. Next slide, please. And move on, please. No. Okay. So who are these major players? Well, we have the major funding agencies, and that's really led by Global Fund. And we have Bill and Melinda Gates Foundation. We have all the bilateral donors like JICA and USAID and DFID and UNIDA, and lots of UN agencies. Again, people tend to think of just one UN agency, World Health Organization, and not the whole range. There are lots of different players in the UN agencies that need procurement and supply chain management staff. So don't think too narrowly, oh, I've got to work for World Health. No, there are many UN agencies, many bilateral players, many multilateral players involved. Next slide, please. So in the Global Fund, one of the largest players for HIV, TB, and malaria often require vertical programs, often require them to be run independently with separate staff because they have quite different rules, quite different accounting requirements than the country might have for its overall health system. Gavi have recently announced major support for supply chain. Just in March of this year, a major program to help support supply chain. So they recognize the need for procurement supply chain staff and for procurement supply chain training, because you're not going to get this training at pharmacy school and you're not going to get it at management school. We need to combine the two in specific procurement and supply management training for public health. Next slide, please. Organizations in global health, of course, Bill and Melinda Gates Foundation is a major player. They've played a key role in developing new products, also in major disease group. Global Fund is focused on TB, HIV, and malaria. Bill and Melinda Gates Foundation has a wider focus, as include pneumonia, enteric diseases, diarrheal diseases, a large amount of activity across it. Lots of different programs operating under the Bill and Melinda Gates Foundation. Next slide, please. Are there really jobs? Are they really going on? Well, don't listen to an old man talking. Go and look at the UN job site. Just type in supply chain and see how many jobs are going around the world globally, but only for people who are skilled and qualified in public health supply chain. And they're not just UN jobs. There's lots of implementing agencies as well. Please look at next slide, please. This is MSH, just one implementing agency, and there are many, like Commodities as well, implementing job sites there for procurement supply chain management staff, but only for qualified staff. Let's take a break there now. And Sonia, if we can run the first poll, please. If you'd like to go ahead and answer this poll, please. Straightforward, just so that we have basic background and we can adjust the presentation slightly based on the results of the poll. Excellent. I see we're getting some people answering the poll now. Wonderful.
I will request everyone to participate in the poll. I can see numbers going on, and almost 60% have voted. We will give, we have another 30 seconds, and so I will request everyone to participate and complete the poll. Oh, we are almost there. So anyone who's just finishing it can do it in another 10 seconds max, and then we can stop the poll. So I think we can stop the poll. We have got almost like 72% who have voted by now. Yeah. Please showcase the results. Over to you, Andy, Professor Andy.
Okay, so we see that we are majority male, and that's pretty normal, although it's a profession that is open to everyone. Surprisingly, we don't seem to attract as many female pharmacists into the profession as we would like. We're hoping to change that. Age group, okay, the majority age group is above 30 and in the 30 to 40 brackets. That's normal for people who want to progress their careers. They often find at that age group that they now can't go forward, they can't progress into senior management because they need extra training, extra skills and qualifications. And shortly we'll explain what is available to achieve that. Geographic regions, of course, most are from Kenya and others from East Africa, but we have 10% from elsewhere, and 1 or 2 from Southern Africa as well. That's good. So good that you can all come along, and you're all welcome to be with us today on the poll. We'll adjust slightly according to that. We'll allow for people from other countries and make interest a little bit for them as well. Thank you very much for taking part in the polling. I think the main message from the polling is the age group we have today. The majority age group is in the 30 to 40 range. This is the age group where you've been undertaking PSM already. Now you want to advance. You really need some skills and qualifications to do that. Hopefully we can explain how you can achieve that. Okay, we can stop sharing the poll now. Okay, so we were just looking at the jobs. I would encourage you all to check out the job sites, see what is there, see what's on offer. Before looking at extra training, be sure this is what you want to do. Be sure of the job opportunities that are available. Okay, next slide then, please. So there is a chance. FIP, Fédération Internationale Pharmaceutique, the International Pharmaceutical Federation, but in particular, promotes the use of supply chain. They recognize its absolutely crucial need. I would say it's an area that you need to consider. Even if you're not in it now, you should think about it. But again, the requirement is for skilled and qualified PSM managers. Just having undertaken procurement or a little bit of supply chain for 1 or 2 years on its own is not likely to find you a senior position. Next slide, please. So there's a great need for PSM training. Unfortunately, it needs to be quality training, and it needs to be focused on public health. There is quite a lot of PSM training available around the world. There's university courses, there's online courses, but they're not in public health. If you want to work for DHL and the big courier companies, that's fine, but they don't deliver public health. It's a different approach. The training needs to be for adults. That sounds pretty strange, doesn't it? Everyone is an adult who's come into it. They're all qualified, they're all postgraduate, but often we see training which is not really geared to adult needs. Too often it's generic. If we provide training with all the references from North America, what relevance is that to people there in Kenya and in Africa in general? So it needs to be specific for the environment, and it must be for public health. And unfortunately, a lot of the courses available around the world don't meet those requirements. Next slide, please. The Empower approach is an adult learning program. It is formulated as an adult learning program using the ADE approach, and I'll explain that in a few moments. But basically, adults need to know why they are learning. Why are they doing this course? Too often that's not explained. For people coming to Empower, normally they have a clear reason already, but we need to understand that that meets their requirements, meets their answering the question, Why are we doing this? Adults are motivated to learn by solving problems, not by rote learning. And again, we try to bring that forward. The whole approach of the courses are, how do we solve this problem? What methods, what techniques, what resources can we engage to solve the problem? Not just pouring out rote methodologies. Previous experience must be respected and built on. All of our tutors, everyone in Empower has worked, has done the job. We're not just academics. I came to academia very late in life. I'd been more than 30 years in warehouses, in procurement units, operating in low and middle income countries before coming ever to teach about it. And all of our people have done that. We've all been and worked and understand the realities of the operation. Adults need learning approaches that match their background and diversity. Yes, it's not one size fits all. There are different approaches according to the environment, according to the location. And adults need to be actively involved in the learning process. They certainly are. And we encourage that involvement all the way through. In fact, we demand it. And that can be quite difficult to people who have been only through classroom learning. It's not all talk and chalk that we do. You have to think, you have to respond, you have to be active in those programs. And that's difficult because we're going to be asking difficult questions all the time, because that's the reality of procurement and supply chain management. It's constant challenges on how to overcome these difficulties to get the supplies through to the patient. Next slide, please. So what is this ADE approach? It's a recognized management approach, which consists of analyze, what are the goals? What is the target audience? What are we trying to achieve? Design the course so it meets those objectives. What are the learning objectives? And at the head of every chapter that we deliver, you'll see the learning objectives and the goals clearly stated. What are we trying to do in this chapter? What are the instructional strategies? Yes, we have didactic approaches, but we have many other interactive approaches as well. They're going to develop the learning resources and then constantly revise and update them. We don't just write them one time and forget about it for the next 10 years. There's lots of courses available like that. They have to be constantly updated. They're validated, and we'll explain the validation process shortly. Then we have to implement it, actually go out and do the teaching, the instructions. Then evaluate. How well did it do? What can we do better? And that's where we elicit feedback from the students all the time, which is from you on the course, what's happening. And that's the ADE approach that we use for adults. So all our students are active members of the course. It's not just sit back and listen to the old professor talking. You have to be involved. You have to work with the course to get the most from it. Next slide, please. Okay. In order to do this, we use a blended learning approach. Unfortunately, online learning has acquired something of a bad name. Too many people have just taken a load of PowerPoint slides, put them on the internet and said, that's on power learning. Well, no, it isn't. That's a load of slides on the internet. That is not online learning. For this approach, we use a blended learning approach. So even though most of it is web-based learning, there is still some face-to-face learning. And that's why we're in partnership with University of Nairobi to bring that face-to-face learning element right there. It's not just listening to online slides. Micro-learning, messages on mobile phones, little pithy instructions, day by day, every day, so that we don't forget the major courses that we're undertaking. Virtual laboratories, where you can try out what-if scenarios. We introduce new concepts. Okay? You can try them out in the virtual lab. Does it really work? Does this quantification technique work? What is the economic order quantity? Could I really use that in my country, in my environment? Does it make sense? Can I do the calculation? You can try it out in the virtual lab, see what works. Adaptive assessments, that is, assess how well you're doing and you can adapt different parts of the course to your specific needs. And finally, gamification. I had to learn that playing games helps people to learn. And fortunately, my grandchildren were able to teach me this. And I'm sure it's the same for many of you as well. People can learn through games. It brings a little joy, but they're always a learning element. We're not just shoot them up, shoot them down type of games. It's actually undertaking what happens if I do this in the supply chain? What happens if I order too much? When do I get the expiry? All of that comes together into a blended learning approach. So whilst it is online learning, it's not just slides on the internet. It goes a long way beyond that, into all of these categories put together. Next slide, please. Then finally, we undertake the assessment, the evaluation of the impact this training has had. And for that, we use an established management model called the Kirkpatrick model. There we undertake the learning experience. What's the reaction of the students? How well did they like the course? What did they feel about it? Has there really been an increase in knowledge? And I'm going to explain how we measure that in a few slides. Behavior change. Have they really changed what they do? Does the warehouse manager now manage the stock in a different way than he did before? Does the procurement unit operate in a different way? Does the quantification unit do things differently now? And then the organizational impact. How well is the overall operation, the whole of the procurement supply chain management changed? Has it really got better? Are the key performance indicators any better now because this person has received the training? So it's a measurement across the whole activity. Once again, students start the experience with the learning experience feedback. We want to know how well, and we take great notice of that and adjust the course accordingly. Next slide, please. Certification. Well, University of Nairobi is well known to you. The Empower School of Health is accredited by ASIC, which is the UK-based accreditation organization for overseas universities. We work with many partners, donors and collaborators, Kent State University, and on the screen you can see a whole range of universities from Mahidol University in Thailand across the whole world. Different groups that we work and are established with. We are recognized and certified as an educational institution. It is quality learning. Next slide, please. Lots of courses. Our flagship course is the Postgraduate Diploma course. That's a 12-month course in collaboration with Kent State University from the USA. It's online, so although we've said 12 months, it's nominally 12 months. It takes about that long, one module per month to undertake the course. Coming very soon is the master's degree course. That will be a 24-month course. Again, it's taken online. You can go at your own speed on that, available in English and French, we hope, quite shortly. But for now, Postgraduate Diploma, 12-month course, a number of you may have already undertaken it. Lots of short courses from 6 months through to 2 months in all the different areas. And yes, there are some free courses available there. The UNDP course down at number 16 on the list, Introduction to Procurement and Supply Chain Management, is free. You can take that online, you can follow it online. But it is only the introduction. The Global Fund course on the evaluation is also free. Again, you can take it online, but it is only the basics. More advanced ones are in the main Empower body. And I'll talk in detail about some of those courses next. Next slide, please. So why would you undertake a short course? Why don't you do the 1-year diploma course? Well, understand that procurement and supply chain management is a very large field. If we go through the classical diagram of procurement and supply chain management as taken by the Global Fund. We start with product selection, which is drug and therapeutic committees selecting the types of products that we want, all about essential medicine lists, all about the essential medicine concept, and applying that not just to medicines, but to health products and medical diagnostics and equipment as well. Medical devices, diagnostics and equipment. Onto forecasting, quantification procedures. How much do we want? And the budgets, and how do we fit it in the budget? Because we've never got enough money to buy everything we want. And about ABC and Venn analysis to enable it to fit within the budgets. About the whole procurement process. And that's really having a big shake-up now because of COVID, because of pandemic situations. We've had to totally rethink how we undertake procurement. Inventory management, a massive area, and unfortunately in public health supply chain, often very severely limited by the lack of data. Often we just don't know what we've got or where it is reliably. And that then makes forecasting and quantification difficult because we're not getting good consumption data. Distribution, often difficult. Last mile distribution is often the most expensive part of the distribution process. It's often 40% cost of the distribution process. And yet we're not undertaking that very well in lots of places. We have to look at realistic and cost-effective last mile distribution solutions. Then the area that's nearly always forgotten and neglected, ensuring rational use and pharmacovigilance. Particularly important as we've introduced lots of new products for COVID. And we have to have pharmacovigilance to monitor those new products and what's happening. Because they're new and we don't know what all the effects are. We don't know how well the supply chain is handling them. So it's a very wide area. It requires lots of management, from procurement policies, quality assurance of medicines throughout the whole system, international and national laws. Well, we're not lawyers, we don't have to know about that. Well, in fact, you do. What's the difference between a civil contract and criminal law? Well, under civil law, you have to pay to take the case to court. So if there's a contract default, that's civil law. You have to pay, and if you lose, you'd have to pay all the costs. It's one of the reasons we ask for all the certificates from the manufacturers. Why do I ask for all this paper? The manufacturer, he could write anything. Well, he could, but if he does, that's an act of fraud. Fraud is a criminal offense. So if he sends me a batch certificate that is not correct, that's a criminal offense. Under criminal law, the police take the prosecution. I don't have to pay. So I need to know about international and national laws to be able to invoke civil and criminal law in the management of contracts. Coordination, well, everybody wants coordination. Nobody wants to be coordinated. Many different agencies, many different bodies operating in the country, all undertaking different bits. Trying to put them together is never easy. And of course, our biggest need, management information systems. Huge need for improved computerized management information systems, often well available in the private sector, but in public health, still very rudimentary and very basic. We have a long way to go in that area. So it's a very big field. Next slide, please. Many people have been working in that field already. Our biggest age group is in the 30 to 40-year-olds. You've already been working in procurement and supply chain. And many of you may feel you know one particular area quite well already. You may have been in the procurement unit and feel, well, I know procurement pretty well. Or you may have been in warehouse and you think, well, I know inventory management pretty well. But almost nobody knows everything. Almost nobody has all the skills in all the areas. And if we are to manage procurement and supply chain management correctly, then we've got to have a wider skill base. We can't have this silo mentality of, I just do the warehouse, I just do procurement. It's all got to fit together. This is the coordination. This is the supply chain, the act of linking on to each stage. And we're only as strong as the weakest link in the chain. So often people are well versed in a particular area, but not the whole of supply chain. And they want to fill in that knowledge gap, possibly with a short course of the type that Empower offers. And that will enable skills strengthening in a specific area rather than undertaking the global one-year course. Next slide, please. Well, how do you measure how well you're doing? And how do you measure areas where you might need strengthening? On the Empower website, available free of use, is the Competency Assessment tool. You can take this assessment, it's confidential, nobody will know your results except you. Undertake the assessment and you can measure how well you're doing in all the different areas of the supply chain. Take the assessment, look through, well, I'm doing pretty good in procurement, I've scored more than 80%, pretty good. But supply planning, we can see on the chart here, forecasting, this person only scored a little over 40%. Needs some serious strengthening in that area, in quantification and forecasting. Other areas in the middle needs some strengthening. And that's where the short courses can be of value. If there's a particular area where you are weak, you can take the short course to strengthen that area. And after the course, you can take the assessment tool again and see if you've improved. So you've got a direct, independent, confidential measure of how well you are doing. There's over 200 parameters in the assessment. It's quite thorough. It does need a little skill to use it, but most of you should be able to follow it through quite well. So again, it's free of charge. It's available on the Empower website. Why not undertake it? Measure yourself, measure how well you're actually doing. If you are scoring under 40 in many areas, then you really need to take the one-year course or beyond on that. If it's just a specific area, like forecasting, quantification, then a short course just in that area might fit your needs better. That's the key requirement. Undertake the assessment, measure how well you're doing, because we all tend to overrate just how good we are. We're in the procurement unit and we're doing the job, but we don't actually see all the procurement going on in the country. Often the bilateral donors run their own systems. Global Fund always runs its own system outside the box. Yeah? And we don't always get that range of knowledge of information within one particular unit. So this tool measures personal competency assessment in public health, procurement and supply chain. Please look at it, please have a go at it and follow up and see how well you're doing. Next slide, please. So what does this mean? You can analyze your skills, see where you're weak, and then decide to select a short course if you feel that's appropriate. If you need more general, then the one-year course is perhaps for you. But I'll describe now 4 of the short courses that are available. One is International Careers in Global Health and Supply Chain, then Inventory Management of Public Health Products, Procurement and Supply Chain Management Support Functions, and then Quantification and Forecasting in Public Health. Next slide, please. Okay, the International Careers in Global Health. Who's it for? Anyone looking for an international career. Doesn't mean you have to leave the country. There's plenty of UN agencies, there's plenty of bodies operating within Kenya and the other countries that can do that. To undertake this course, you really need a bachelor's degree as a minimum. If you've got more than that, it's fine. It would really help if you have experience in public health and a little bit in supply chain. Course is run in English. It uses online instruction. It's about 10 hours of learning content. So you have to commit to follow that. It's quite difficult. You can't just go and straight in. You have to read the material in advance. Lots of reading material you have to learn after the course. It's not just 10 hours. It's 10 hours of contact time, 10 hours of learning with the online system. There's much more to do than that. Full repository of courses, charting your own way through. There's lectures, quizzes, webinars, groups, and a possibility of an internship with Empower. No, we don't pay you. You can do an internship with Empower to gain experience with one of the organizations. Next slide, please. Okay, so what's actually in the course? We start with module 1, global health, an overview of the principles. Well, we've been working in global health. How many of you know what the WHO Charter is? How many have got the key points? How many of you know what the key points of humanitarian healthcare is? How many of you can locate the Sustainable Development Goals and tell me which PSM are linked in the Sustainable Development Goals? Very few, I suspect. And that's why this course is present, to give you an overview of the principles, the measurements, what we're doing, and some of the basic economics around that. What's the per capita health spend in Kenya? How does that compare to the USA? Got any idea? That kind of information, that kind of knowledge to set the picture of how we have to operate differently in a public health perspective. Healthcare systems, policies and management, overall health policy. How many of you read the National Health Policy? How does that impact procurement and supply chain and what we're doing? How many know what the full health structure is in the country and how it impacts what's happening? Who are the key stakeholders in global health? Well, there are many, and people often don't know them all. People think, well, there's UN agencies. Well, which UN agencies? Well, UNICEF, UNAIDS, but what does UNDP do? And what do the other UN agencies, UNOPS, do? They can be involved in healthcare as well. What career channels are open to you in health? Well, it depends very much on what your base qualifications are, but there are lots of opportunities, and often people don't look at the opportunities. They're too narrowly focused on Ministry of Health. Yes, they're a major employer, but not the only one. There are lots of opportunities available. How do you get to join these global health organizations? It's not easy. And you have to be qualified. If you don't have those qualifications, you don't get through the starting gate. How can you plan a career pathway? Well, that's an important point, especially in procurement and supply chain. Often there's not clearly charted career pathway. It's a bit messy. Most countries don't have a clear career structure. And having your own plan, your own pathway charted can help you navigate through that and come along. This course is really a foundation course of how to work with the agencies. And even if you never get a job with them, knowing about them means in future you'll be able to coordinate and work with them better, work with them more effectively. How does the NEDA undertake funding applications? Oh, don't know how to go about it. Well, you might learn. You might be able to know about bilaterals and multilaterals and the different agencies and how they interact. So that's one course on careers. Next slide, please. Inventory management. Well, many people working in the warehouse, so I know how to do inventory management. No, you know how inventory management is done now. Think about what happens in the private sector. Frankly, they're light years ahead of us. How many of our warehouses have got barcode scanning linked to computerized stock control? How many have got barcode scanning for stock locations in the warehouse linked to stock control? What happens down at provincial level? What happens at districts and at clinics? Do they have barcode scanning? Yet private sector has it throughout. So inventory management incorporating new technologies, incorporating new management styles. Who is the course for? Ideally, you've already been working in the field. You need some work experience in public health is with government or with NGOs operating in that field. Next slide, please. We look at the course contents, understanding inventory. What items have we got in inventory? Analysis of inventory using the ABC and Venn techniques. Typically, 20% of the products will account for 80% of the cost in the inventory. Yet how many of us actually manage the cost? How many even know what the total cost of our inventory in the warehouse is? Stock records and standard reports, yes, straightforward, but lots of ways to keep stock records, especially for audit concerns. How do we go about managing according to financial regulations and international standards? Why does Global Fund often insist on its own systems? Because it wants them to international financial standards. And regrettably, not so many of our public systems meet those standards just yet. Selections of items to be held in stock using formal procedures, following essential medicine and essential health concepts. Not just picking up random, not, oh, I think that would be right, but a formalized procedure of how to select the products to be in stock. Inventory control models, including modern models, economic order quantity, economic order levels, economic order inventories, and reorder frequencies. How often should I reorder? Is it more economic to have a little bit of stock and order regularly every month, every 2 months? Or should I have 1 year stock and only order once a year? Which is most cost effective? How many of you have ever done that calculation? How many have ever looked at those cost bases? Advanced models in inventory management, the economic order levels, complex calculations, especially around service levels. What's our service level? Again, how many of you know what your service level is? Are you trying to meet 95% service level? That is that you're guaranteed to have 95% of the stock available every day of the year? Or are you going for lower levels than that? Often we never specify it in the public sector. So we're trying to meet goals that we don't know what the goals are. And we have to get used to specifying and measuring and using systematic management techniques for those levels, specifying and measuring and achieving them. Standard inventory calculations, particularly around costing, which we're not good at in the public sector. We bought it, its cost is gone. No, it isn't. What's the expiry rate? What's the cost of our wastage rate? Are we controlling it? Are we analyzing it and seeing what is happening? How does the course work? Well, it's basically web-based training under the blended learning technique. It's self-paced, so you go at your own level of learning. There's a help desk and student support available. And of course, it is aligned with global standards, both for financial standards and for good storage practice, good distribution practice under the WHL good regulations. What do you need? Well, reasonable internet connections are essential for that, although now you can download the slides onto a mobile phone and access remotely if you don't have good internet. Next slide, please. Procurement and supply chain support systems, that's all the support mechanisms that go into the PSM system. So throughout the system, I need product quality assurance. And people tend to put that off on one side, well, that's laboratory. No, it isn't. It is a management technique. Quality assurance is a management technique, and we need it throughout the whole of the supply chain, from the very first product selection. We have to select products which we know we can maintain the quality. The vaccine for COVID, the Pfizer vaccine, has to be stored at -70 degrees. How many of you have a cold chain at -70? Then what's the point of having that vaccine if I can't store it? I can never maintain the quality. So I have to select a product where I can maintain the quality. Certain items, I know they've got quality problems. Amoxicillin syrup for children always goes black and grows bugs in it. Perhaps I shouldn't be buying the syrup. Perhaps I should be buying powder to make syrup. Those are kind of selections, choices, which quality assurance comes into. So that's throughout the whole of the supply chain. How do I receive a product? How do I verify the quality? How do I maintain the quality? And the forgotten area, pharmacovigilance. What happens when I get a report of poor quality? Who actions it? Who does what to make it happen? These are parts of the support systems. Of course, data management, MIS, also goes through the whole of the supply chain. Financial impacts of PSM, often totally forgotten. How many of you have actually ever made a financial calculation for PSM? What's the cost of the warehouse? What's the cost of your storage? What does it actually cost you as a percentage of your annual buy, of your annual turnover of products? How many systems have ever made the calculation? There's nobody in the private sector who doesn't know that to 3 decimal places, and they struggle hard to control it. Yet in the public sector, often we're not even measuring it. So this is part of the course, how to undertake those financial impacts, how to manage the funding for PSM operations. Who is it for? People who've already worked in the area, either governmental or NGOs, in public health. Next slide, please. Specific course contents, organization and staffing of PSM function. How many staff do you need for the PSM? Well, we actually have numbers to help you calculate exactly how many staff you need based on the product throughputs. PSM data and information systems pyramid. How do we control the data? How many of you got cybersecurity? Who's ever thought about a cybersecurity for the public system? You've got computerized sections, you've got PCs across the supply chain. What cybersecurity have you got? You've seen major hacking, major downfalls of health services in Europe and in the United States. It's not yet really come to low and middle income countries, but it will. Ransomware will come, they will attack your system. What cyberware security have you got? Managing that data pyramid, managing data security is a fundamental point. Implementing logistics management information systems, it's often a very long-term process. We don't just buy a computer and stick it in and that's it. There's a lot of system work, a lot of development work that has to go on. Pharmaceutical quality assurance, who's ever heard of the WHO 3-tier testing system? It's over 30 years old, and yet we're still not implementing it. We're still sending far too much for laboratory-based testing when we should be using management techniques of quality assurance and a little bit of lab testing. Financial impacts across the board. What's the difference between procurement frequency and stock frequency? How do I calculate the two? Which is most cost effective? How does the system work? What's the best distribution rate? Cost implications and impacts, looking at the basics of those. Funding, how do I manage funding for PSM projects? I've got a big grant from the Global Fund. Did I include any funding for PSM? Well, only about 5% of grants do. Why are you not getting money from Global Fund? Because you never asked for any. How do we get PSM costs, the costs of storage and distribution, included in donor grants? Part of the funding management requirements. Next slide, please. Quantification and forecasting in public health for commodities. 2 months course. It's quite intense. You do need to be numerate. You do need to be able to use Excel to undertake this course. Some experience working with public health supply chain in governmental or NGOs is preferred to undertake the course. Next slide, please. So what's in the course? The overview of quantification, what are we trying to do, and the major quantification methods. Many of you will be familiar with the consumption method and the morbidity method, But how many of you understand the basics of the morbidity method? What supplies do we need for COVID? Well, it's not just the vaccine. It's all the PPE, the personal protective equipment, the gloves, the gowns, the face masks. How do I calculate how much of that I need? Well, there is a WHO quantification tool to help you. But if you don't understand morbidity quantification, it's very difficult to use the tool. And as WHO has found, it's a lot of trouble to try and implement the tool when people don't have the basic quantification skills. The drawback on estimating how many COVID supplies were needed is largely that people couldn't do morbidity quantification. We teach that as part of the course, real, actual undertaking Excel calculations in sheets, comparing the numbers, the theory and the practice to gain the skills in undertaking morbidity-based quantification. Proxy consumption method, what do you do when there's no data? I've got no consumption history. I've got no morbidity data. COVID, how many COVID cases are you going to have? No, don't know. Then what am I going to do? I can't use the consumption method. I can't use the morbidity method. I have to use proxy consumption. That is, I use models from other countries or other regions. And as we look at pandemic planning and new disease outbreaks, Ebola, what do I need? Well, I don't know. What's the consumption method? I can't do it. I've got no history. What's the morbidity method? I don't know how many cases I've got. We can use proxy-based consumption to estimate what would happen if there was an Ebola outbreak and what supplies I would need. Finally, we have service level projections, often forgotten. It's a way of verifying. How do I check the quantification I've done is correct? Often quantification is under a great deal of time pressure. Push, push, push. You have to have it today, must have it today, must have it today. What are the numbers? It's easy to make a mistake. That's why we have the service level projections to check the numbers, to make sure I haven't slipped to zero and I'm going to order 10 times too much. Quick service level projection undertakes that verification, brings it forward and brings assurance. 40% of quantification PSM plans are rejected by Global Fund because the quantification is wrong. 40%. Doesn't work, it's not right. Had we have used service level projections, we could have picked up those problems before it ever went to Global Fund. And then we don't have this submit, come back, submit, come back, bouncing the paper around and lose 6 months in the process. If we have good quality quantification to start with, well documented, we can go into the method straight away. Okay, next slide, please. So PSM is an exceedingly challenging area, but it's an exciting area. It's been my career for 40 years. It's come to the forefront now because the global COVID pandemic has highlighted, didn't cause this need for extra skills, it highlighted the need we have to have for skilled and knowledgeable staff. But the staff must be skilled. You must have qualifications and the ability to undertake, to practice those skills. COVID has shown that up remarkably. COVID vaccines is about to show it up even more. If we don't have those skills available, we're not going to succeed on the vaccination program. I've talked for a very long time. It's now time for me to stop and hand you over to Rahul.
Thank you, Professor Andy. Thank you for such an overwhelming presentation and getting into the nitty-gritties of each and every course, the content which is there, why the PSM career is now going ahead, and people are asking for courses in procurement and supply chain. They are doing various other learnings or books are there on the supply chain management which are available, and I'm happy to inform everyone that these slide deck will be sent to all, as I've seen in the chat box, a lot of requests, and you will have those links. You can download various free resources which are available. So let me now come to how you can now enroll in these courses. What is the application process? How, as you all know, that these courses have been now jointly partnered with the University of Nairobi and University of Nairobi Education System, and along with Empower School of Health and University of Nairobi, both are supporting the students to enroll in these courses. And so if you are going to enroll through University of Nairobi School of Pharmacy, then you will be once you write a mail to UNES, the communication mail is there, unbi.ac.ke. You will get a Google form link. You can even once you get the PPT, you can copy and paste it in the browser. You go to the Google form and fill in all your details. Once you fill in all your details, the Google form is written back to the University of Nairobi, and there then you will get further communication as to how you can further move ahead with the other processes. Next slide, please. And in case you opt for registering these courses through Empower website, that is also available. For that, you have to click on this link, which is available, and which you will be getting after this webinar through a mail, the link. So you can go to our website, select the course which you want to enroll, click on the explore and enroll option. You will find an application form. I'm just given a snapshot of the application form. So these are the various various queries, like various questions like first name, last name, what's your mobile number, organization, years of experience, what kind of qualification you have, and you can send in all your details there. Once this query or application form is received by the Empower team at the back end, they will be contacting you back on a mail, and all the details of the fees for that particular course and the enrollment procedure will be sent to you by mail. And once you have initiated the payment method suggested, or the payment method, I will discuss it after this slide. The course access username and password for that course will be provided to the participant. So this way, both from University of Nairobi and Empower School of Health, you have got an option to enroll in these courses. In terms of the payment options, you have both the offline and the online option. You can choose anyone. Even you can do PayPal transfer, online transfer, and you can even wire the amount in the bank account details. So these details are mentioned on your screen, both for the University of Nairobi School of Pharmacy and also the Empower School of Health. So once you can use any of the methods, you will get a participants have to even save that the payment, the way you have payment done. You can take a screenshot, or you can share the notification, whatever you have paid, just save it carefully, and the paid amount can then be forwarded to either Empower or to UNES to ensure that you have paid it and it is for reconciliation purposes. So once the payment is done, I told you, the student gets enrolled in the courses, and after the courses are finished, the students get the certificates of that courses as per the course you have opted for. Next slide. So both at the Empower front, and I've heard, and we are seeing a lot of queries are coming, not only to University of Nairobi but also to Empower School of Health. So if you want to contact us, if you want to have more detail about any question, any query you have about this course, you can write on to this email ID, or to the to partnerships at empowerswiss.org in my name, or you can write it in name of Miss Sonia Notial on operations at Empower School of Health. And we have another email ID, info@empowerswiss.org, where You can put in any of your queries on whether you want to do any specific course. So this is how the whole application to registration process is there. So and I see and I see a question as a Kenyan, what is the advantage of applying through UN and not directly to Empower School of Health? So it's a joint collaborated course. You have both the options we have given for the ease of the participants. Advantage remains the same. You learn about the course. You get a joint certificate from both University of Nairobi and Empower School of Health for your that you have cleared the certificate. So that's the advantage, whether you want to go directly to anyone. This is all from my side. And yes, now I think we should go ahead with our poll number 2. So I will request team to launch poll number 2. So I will request the participants to answer poll number 2, which is now in progress. So this will help us to understand your career aspects. What kind of are you looking as a career for global health supply chain? How did you hear about this webinar or these courses? And then you can whether you are from University of Nairobi or from Empower School of Health or from any other council or FIP or wherever you are from, it will just come to know. If in case we can then touch base to you accordingly about these courses and how do you like this webinar. So this just a feedback poll number 2. So please I'll request everyone to fill in the poll. So I see people are filling in. We are getting people giving their answers to the poll. So please do keep doing that. Please fill the poll. That is very important for us to understand you as an individual, and then accordingly, the details will be sent on your mail. I can say 50% of the people have voted, and it's still progressing. So another 30 seconds. So I'll request everyone to vote and answer the questions. Another 10 seconds and then we can stop the poll. So I'll request everyone to finish the okay, so we can stop the poll and share the results. So it's very interesting to know, Professor Andy, almost 98% of the people after hearing you want to get into the career of global health supply chain, and mostly have heard from both University of Nairobi and Empower School of Health, the participants, and I'm very much thankful for them to join. And others, there are around 21%, and there are a few people who have joined, have come to know from IAPHL chapter, so IAPHL, so that's good. And mainly through emails, social media, through friends, so 64% by email, so that's great. It seems that our mailers are quite interesting and people are reading it, so thanks to the team for making it interesting. And yes, there are member, alumni, staff. There are almost like 50% from University of Nairobi, and then 21% from Empower School of Health. It's very interesting to see people from FIP and Pharmaceutical Society and Council have also joined. And have you taken any course? So almost 90% have not taken, but yes, they are interested, and few of them have taken the courses, so that's great to hear. And almost 86% have found it very useful, so it's a very good encouraging part for us, and we will try to do such webinars in future along with UNES on specific topics. And thank you so much everyone for voting on the poll. So now I will give the floor back to Dr. Sheetal Maru for taking over, please.
Thank you, Rahul.
Yeah.
I just want to emphasize on the Kenyan students that we, as University of Nairobi, being a premier university in Kenya, #1, in East Africa, #1, in Africa, we are in the top 10. I came across Professor Paul and Professor Andy during one of the Pharmaceutical Society of Kenya webinars. And with the aspect of improving pharmaceutical systems management in Kenya, with regard to giving universal health coverage, access to medicines is one of our key agendas as well, with even the SDG and the Agenda 2063. So Empower, being a giant, a premier institution, and you can see Professor Andy with a lot of experience in pharmaceutical supply chain management, procurement, systems management, and we partnered up as a university with them so that we can bring the best to the African continent. We want to train people to handle our systems better, to manage our medicines better, to manage our health products and related technologies better, so that we can do our jobs. For those of us who are looking at international jobs, Africa, it's time we actually pull up our socks and we get onto those international platforms where we can do our jobs right. So this is a platform where we engage and we want people to join. It is well recognized. Empower is well recognized throughout the international agencies, and the certificates and the courses are well recognized. They're researched very well, and the techniques of teaching is unique on its way and quite up to date. So I request all of you, if you would want to join, the courses are there, the details are there for you all. For the Kenyan students, we've just made it easier for payment through UNES, University of Nairobi, so that you can just send your money via the M-Pesa and you can join on. These courses are specific to your work needs. And I wish you all the best, and I hope to see quite a lot of you join these courses. We are bringing on board a few more courses to join in, and please have a look at the website as such so that you could get more information. I would want to give the floor to Ms. Belinda Muriuki, who is the manager for UNES, so that she can actually emphasize on or she can tell you on how to go about if you're applying through University of Nairobi UNES platform. Belinda?
Thank you very much, Dr. Shital. I'm trying to unmute the video. I think it has been disabled, but I can speak. I wanted, before I give like my closing remarks, I've seen there are some questions that have been asked on the chat box. So I think we need to address those ones first before I give my closing remarks. I think Rahul can go through the questions, because some of them I've seen participants are asking whether people from other specializations besides public health can be able to register for the course. I've also seen somebody asking whether the certificates are recognized globally. The other question I've also seen is that whether the participants can be able to apply directly to Empower Health. Do they have to go through the internal registrations forms of UNES and the University of Nairobi? Those are some of the questions that I feel we need to answer them before I can give my closing remarks. Dr. Shital?
Yes. Rahul, would you be able to answer a few of these questions with regard to payment and platforms?
Okay, perhaps I can start and we'll let
Okay.
Rahul come in on those.
Yes.
I'm asked, are pharmacy students eligible for the free courses? The answer is yes, you're eligible, but they're quite challenging. And if you don't have some experience in procurement and supply chain management, I would suggest it really is probably pushing the envelope. But you're welcome to try. You can apply for them if you wish. Can people from outside pharmacy? Yes, of course. Any of the medical fields or any of the management fields. You need two skills. You need management or public health. If you're coming with neither, then I would say that's a pretty big challenge. And it helps if you have one of those skills. If you've undertaken some management function, that's good. If you have experience in the field, but no formal training, again, we're quite willing to look at you, provided you're articulate and numerate, because quantification does require reasonable numeracy skills. But experience alone will qualify you to enter most of the courses.
Good. Thank you, Professor Andy. I think we have covered quite a few of the questions. The slides for Professor Andy's presentation and the webinar itself would be on YouTube. So please feel free to access the YouTubes, and the Empower team is going to be circulating it on social media as well. If you look at the chat box on the right-hand side, you have those links that have been posted for Twitter, LinkedIn, and YouTube, so you'll be able to access them. Please do so.
Okay, I see I've got one more question coming there about the Kirkpatrick model of capacity building.
Yes.
This is a standard management model. If you Google it, you will get lots of information on it. It's on the slide. You can access all the slides that we provide to you. It's a standard assessment model. It's not one we've invented. It is a management model. Again, our courses are a combination of management and public health put together, specifically tailored for public health in low and middle income countries. So Kirkpatrick model, please Google it. You will get lots of information from all around the world on its use. Sorry, Dr. Shital.
Yes, Prof. Andy, there's another question from Ethiopia, and says, can I apply for the course for free?
Well, there are some courses that are free. The UNDP Introduction to Procurement and Supply Chain Management is funded by UNDP. That is free. The course from the Global Fund on the Financial and Economic Planning is also free. I'm afraid the other courses are not free. You can ask for scholarships. Increasingly, donors will not allow agencies like ours, will not allow universities to ask for scholarships. The country must ask the donor for the scholarship. So, as I said, only 5% of Global Fund grants include any funding for PSM. Why not include a block of funding in your Global Fund grant application for PSM training and use it for courses like this, to apply for these, to apply with University of Nairobi for courses. People are not asking for scholarships, which is why they're not getting them. You cannot ask always the educational institution. You must ask the donors. Increasingly, the donors will not accept applications from educational institutions. It must come from the people in the country. That's what you want to do. And there is funding through the donor agencies if you apply.
Thank you, Prof. Andy. I would just want to emphasize those of you who were interested in joining the short courses, you get a scholarship and a 10% waiver from the fee. So the earlier you apply, you get a 10% waiver on the fee for those courses. And having said that, Rahul, would you want to make a closing remark?
Thanks, Dr. Sheetal. I think majorly all the questions have been answered, and even the scholarship part is very well, responded well by Professor Andy. And yes, for the people who have registered with UNES or with Empower, there is a 10% scholarship in terms of a waiver of fees at present available. So you can ask for it, you can write it to UNES or Empower School of Health, and we'll support you in getting that. The final remarks is with Belinda. So over to you, Belinda, for your final remarks. It's fine from my end now.
Okay, thank you very much for this opportunity. It gives me a great pleasure to address this closing session. Allow me first to convey special thanks and appreciation to the Empower School of Health, University of Nairobi Enterprises and Services Limited, and the University of Nairobi Department of Pharmacy and Pharmaceutical Practice for co-organizing this important webinar. Special thanks to Professor Handy for sharing important knowledge and information on the courses on offer. He's really taken us through the purpose, the structure, overview, and the overall benefits of the courses, specifically in the areas of global health and procurement and supply chain management. And we've all known that the courses will really equip the professionals in this area with skills or knowledge for them to be able to estimate their country's needs and for health commodities. Our distinguished participants, we really appreciated you taking some time off your busy schedules to attend and listen to this important webinar. We are really glad of the active engagement with our partners and resource persons and the pertinent questions that you have raised in your question and answer in the chat box, and I want to believe that all your questions have been addressed. For the ones that have not been addressed, you can email us on the email addresses that have been provided, both for UNES and for the Empower School of Health and the Department of Pharmacy and Pharmaceutical Practice. We've also seen specifically a lot of areas have been highlighted. First of all, it is very important to note that our experts are former employees of United Nations, so the courses are really industry-based and relevant to the current environment that we're experiencing, especially in these times of COVID-19 pandemic. We've also known about the challenges that have been presented in global health and procurement and supply chain management, mainly in the infrastructure, and also there are a lot of issues on HR capacity building, especially in public health management, and these courses will really be addressing that HR capacity gap that is there. We've also learned about the various new health products that are being on offer, but they're not reaching the patients. So the courses that have been presented to us will help us to be able to come up with efficient systems that will enable us to be able to deliver a better procurement and supply chain system and processes. We've also been highlighted that the courses also uses blended learning techniques, and they're taught in English. So I would really encourage everyone to register for the courses and take advantage of the 10% scholarship that have been provided on these courses. I personally wish to express my gratitude to everyone who has attended this webinar, and to our partners. This actually marks the beginning of our concerted efforts to work together between us, the University of Nairobi Enterprises and Services Limited, University of Nairobi, to be able to transform the way people learn, work, and live. So thank you very much, and over to you, Dr. Shital.
Thank you, Belinda. So I would want to thank the Empower team from Empower School of Health, Professor Andy, Professor Paul Lalwani, Rahul, Sonia, for the interaction that we had during this webinar. Thank you all the participants for participating, and we look forward in engaging with you in the near future. The courses are really good. I would suggest please take them on, and if it builds up your career, why not? Thank you, and I hand over to Rahul. Thank you.
Thank you, Dr. Sheetal. Thank you, all the UNES team members, and especially Mr. Seth for his presence and the opening remarks, and also Belinda for the closing remarks, and all the team members. Thank you, Professor Andy, for such a wonderful presentation and giving a brief on the courses, and also how student can take these courses and build his career, his or her career. So thank you, everyone. We look forward for further engaging events in future. Thank you. Bye.
Thank you. Bye-bye. Thank you all for attending.